Coming from a background of, I guess, having a complicated relationship with food and exercise, I was a bit nervous whether that would be, I guess, taken into account. But I was really pleasantly surprised at kind of how nuanced the approach and recommendations were. It was really taken into account here and dealt with very sensitively, as was kind of existing injuries that I had, which like placed limitations on what I can do. Having existing hip injuries have meant that I've not been able to really do any cardio for a while. So I wanted to understand more where my health was at, but also get advice on how I could improve it without aggravating injuries and also kind of falling into that obsessiveness towards exercise again.
So it's designed to be a comprehensive analysis of mobility, strength, cardiovascular health, your lung function, and then your cardiorespiratory fitness. So breaking down all different metrics tied to, through research, to longevity, and then chronic disease risk later in life.
I was pleasantly surprised that I could plank for actually quite a long time when I forced myself to. So that made me feel better, I guess, about my core strength, because usually I'd plank for 30 to 45 seconds and do 3 of them with rests in between. But this was one challenge where you're just trying to do it for as long as possible. I guess I found the balance quite easy. I used to do ballet for a long time, so I kind of got that background in balance. Although, when I had to do it with my eyes closed, that was even hard. Having the opportunity to do the VO2 max test today, that was really cool. In some ways, I am quite surprised the VO2 max test came out as well as it did, because I don't actually do any cardio.
It benefits people of all age groups. Obviously, important to know at any age where you compare with your demographic, where you compare with your fitness, where you compare with your strength. And from there, we can design a personable program to you to help improve those metrics.
And I quite liked how Carter made adjustments based on injuries I had or what my strengths and weaknesses were. So it wasn't necessarily following exactly the same thing for every person.
We perform a pretty comprehensive subjective prior to getting into any of our objective testings, the actual assessments themselves, to make sure that they are safe and appropriate for you. And based on that subjective assessment, we modify the protocol of the tests that we're doing or completely change the tests. So we're still getting adequate data on your strength or your fitness or your mobility, but making sure it's safe and appropriate for you.
There was a lot of opportunity to ask any questions and also to understand what the specific tests were doing, like the different equipment, what I was actually testing, to understand that process as well as the results was really interesting. So it's nice to have the opportunity to ask questions and to fully understand what's happening.
After we've gone through the testing battery, we'll talk about the recommendations for where to go with your exercise programming, and what you need to work on or what you need to maintain. And also provide a comprehensive report. And after testing, we'll send you a summary of your results for each test, how you compare to normative data, so how you compare to your peers, and then provide a set of recommendations from where to go with your training and what we need to improve.
It confirmed what I already suspected, that I need to build up upper body strength, that's something to work on. But I think it's useful to have that confirmed, because then it also gives a bit of motivation. Something Carter mentioned is because was having physio here for hip injuries, I've just kind of kept doing those exercises because I'm a bit scared to progress them in case I do more harm than good. But obviously, as Carter said, then you kind of stagnate if you're not kind of continually building on them. I definitely have an idea of what to focus on, but then I feel like I would want to take it to the next step of a specific plan, and then kind of follow up on how to keep developing that.
Honestly, depends on your results, and seeing, okay, we're using this to identify areas of improvement. So might go, okay, maximally performing well strength-wise. So we may just structure training or give you the recommendation to keep doing what you're doing strength-wise, but maybe we're not performing quite as strongly in our VO2 max assessment, and we need to improve our cardiorespiratory fitness. And from there, it's giving you that guidance to say, okay, we need to either improve our volume or the intensity of which we're training aerobically during the week to improve those metrics.